Welcome to the Functional and Integrative Medicine Podcast. This podcast is all about exploring root cause medicine, showcasing the power of this approach, and inspiring other medical providers to follow this incredible path. I'm your host, Ginger Allen, and founder of Your Medical Liaison, a medical marketing agency working with medical providers since 2012. My passion for root cause medicine and provider advocacy drives me to help medical providers who have incorporated functional and integrative medicine into their practices. So let's dive in. Dr. Joel Kahn. He is a globally recognized integrative cardiologist, author, and founder of the Kahn Center for Cardiac Longevity in Bingham Farms, Michigan. Often referred to as America's healthy heart doctor, Dr. Kahn has spent decades blending cutting-edge cardiovascular diagnostics with holistic root cause approaches to prevent and reverse heart disease. He earned both his BA and MD from the University of Michigan and now serves as the clinical professor of medicine at Wayne State University School of Medicine, a fellow of the American College of Cardiology, and a member of the Physicians Committee for Responsible Medicine. Dr. Kahn is also a published contributor to HuffPost and Reader's Digest. A committed vegan since 1977, Dr. Kahn promotes a whole food, plant-based diet as the most effective way to support heart health and overall wellness. Through lifestyle medicine, targeted supplementation, and a strong focus on nitric oxide optimization, he empowers patients to take charge of their cardiovascular health naturally. Inspired by pioneers like Dr. Caldwell Esselstyn and Dr. Dean Ornish, Dr. Kahn is on a mission to prevent 1 million heart attacks in his lifetime, and he's doing it one patient, one plate, and one protocol at a time. Welcome to the show, Doctor.
Thank you.
This is awesome. You're my first integrative cardiologist that I've had on the show, and I know there's not many of you, so it brings me a lot of joy to have you on the show today, and thank you for taking time out of your busy clinic. So if you could share a little bit about your professional journey and how you got into this integrative cardiology, just give us kind of a brief overview of how that came to be.
Yeah, I'll do it briefly. One little factor was I grew up in a household in suburban Detroit as a child where we kept dietary laws called keeping kosher, Jewish dietary laws. All that meant, besides the spiritual aspect, was from a child, I always thought for a minute before I ate. Was it on my list? Was it not on my list? Was it of good quality? Was it not a good quality? Now, 60 plus years later, I still do that. I have a lot more knowledge in my head, but that was a good background. When I arrived at medical school, and University of Michigan had a program where you did undergrad and medical school together. So I actually started medical school at age 18 and finished 6 years later. You don't get any nutrition training and all, but I quickly decided I did want to focus on cardiology. I started reading a lot of extra material. Once in a while, I would stumble across some what might be called integrative medicine aspects, mainly nutrition, some on exercise. And then some really good stuff started coming out, like the Dr. Dean Ornish study. That was until 1990, a book called A Diet for a New America by John Robbins, who recently passed away, sadly, in the mid-'80s. And then there's Cleveland Clinic icon, Dr. Caldwell Esselstyn, started publishing. And I got very interested, even though by then I was into my career doing procedures on patients, angioplasty, balloons, stents, heart attack treatments. I was already teaching them how to avoid coming back to see me, or how to avoid coming back as an emergency, mainly based on nutrition. I tried to set my lifestyle up for a pretty healthy lifestyle experience, even though being an active, busy cardiologist is almost antithetical to having a healthy lifestyle. A lot of middle of the night emergency calls. But it wasn't really until about 15 years ago that I found a training program in integrative cardiology through a university-based association. And I decided I'm going to take a lot of weekends and a lot of evenings and do some extracurricular activities. And a year later, graduated, first cardiologist in the world to graduate. And took a couple years to let that all settle in. I had already been changing my practice progressively, more lab testing, more lifestyle training, more education on how to avoid medication and procedures. But 10 years ago, in fact, this week, I opened a clinic in suburban Detroit and now also very close to you in Southeast Florida, and have a heck of a good time teaching people how not to see regular cardiologists. I don't mean to offend any, but how to deprescribe, that's a fancy word, but how to try and minimize medication, always in conjunction with good care and their own medical team, how to substitute lifestyle for the dependency on procedures and medications. And it actually works really well. Not everybody's open to adapting it all, but I'll take them at whatever place they're at the start point.
So we're going to dive into what are some of the most common root causes you see in your patient population and how do you address them?
Sure. Well, there's been a lot of research on this topic since the 1950s, 1960s, particularly if you focus on the most common and most serious kind of heart disease, that which causes heart attacks or something called sudden death, which is very scary, very common syndrome, clogged arteries. And we learned in the 1960s, smoking, diabetes, high blood pressure, high cholesterol, mainly what we call LDL cholesterol, diabetes, and family history, but particularly mom, dad, brother, sister, close family relatives who maybe had a heart attack at a young age. The big five that got into standard medical approach questions, calculators online, and everybody needs to be tested and measured for all of those. And of course, root causes of a heart attack are smoking and known or unknown diabetes and known or unknown high blood pressure. I mean, everybody has to own a home blood pressure cuff, or you're really, unfortunately, an amateur in the health world. But since that period of time, 50, 60 years ago, most doctors, and I'm not being critical really, are still practice in that way. They check the big five. There's at least 15 or 20 others, even just the genetic field. There's a kind of cholesterol called lipoprotein little a, very awkward word. I've written a book on that. If I can reach over gracefully, I might pull it just to show the word. There's the word. You don't have to buy the book, but you need to get this blood test done everywhere. Quest, LabCorp, lipoprotein, and it has to be a little a. It's called lipoprotein little a.
Okay.
25% of people inherit that from mom or dad. I see many people that those big five numbers are fine, and this is sky high because of inheritance. And less than 1% of doctors in America check that lab test for $35. So we now have 15, 18, 20 extra root causes, some of which are related to lifestyle, some of which are purely genetic, like that one, homocysteine, an elevated TMAO blood level, but that's related to eating eggs and meat, red meat. So we have my menu of testing for root causes. Sleep apnea, enormous problem that you have to test for, but it's very simple with a home sleep test. So, my patients get a lot of blood work through their insurance. They may do a home sleep study. They may do some genetic tests. It's rare, but still frustrating that we find a patient with serious heart disease, and it's very hard to find a real root cause. The exciting thing is, and it'll take 10 or 20 years, we're finding out new pathways, new chemicals, new triggers of heart disease that we didn't know about 10 years ago. And I think it's a very bright future that actually the lab panel is going to get bigger and bigger and bigger in the testing, and we'll figure it out. So I'm frustrated by those occasional people without an obvious root cause, but they're pretty rare.
So you're doing, it sounds like, some non-traditional labs, referencing the one that you just shared, lipocysteine with the little a. And are there other ones that docs that are, looking at maybe being more integrative that you would recommend they should be pulling in addition to that, or just the normal panel plus that one that you just mentioned?
Yeah. And I just want to make sure people got it right. Yeah. It's lipoprotein.
Oh, lipoprotein A. Thank you.
Sometimes abbreviated LP little a, LP, and then a small.
Okay.
But even just a short list, homocysteine, a blood test everybody should have. High sensitivity C-reactive protein, that's an inflammation test. There's many more inflammation tests. At least get that one. A vitamin D level. How about your blood sugar in the last 3 months? Hemoglobin A1C. And if you want to be fancy, you throw in a fasting insulin level. One of my favorite labs in the clinic is we all hear about omega-3 fatty acids, fish oil, salmon. Mm-hmm. There's vegan sources like ground flaxseed and walnuts, but there's a blood test for it, and it is the most common nutritional deficiency in my clinic. And it's easy to get levels back up to normal through food or, if needed, supplements. People feel better. Their brain fog goes away. Their triglycerides come down. Their inflammation comes down. Their joints feel better. So even that short list can transform people's health.
That's amazing. And I know you've helped thousands of people, and you're on a mission to prevent 1 million heart attacks. But can you share a story about one patient that maybe sticks out in your mind that really had significant improvements to their cardiac health using integrative medicine?
Sure. He's one of my close friends and also a patient, and we started up an organization together because of his passion. But Paul from Detroit, and he doesn't mind if I use his last name because he's all over the web, Paul Chatlin, Chatlan. In about 2013, in his mid-50s, very bad family history of early heart disease, very high cholesterol. But, doctors gave him some warning, but not a real going over. Started to develop rather classic tightness, pressure, burning on playing tennis. He wasn't very active, but he did do some activities. He had blood pressure was up, weight was up. He ultimately decided he was going to go down from Detroit. The Cleveland Clinic is not that far. And some people do that. I didn't know him at the time, get a world-class opinion. And really, very quickly, they said, you're going to need bypass, and you might even need heart transplant. He was identified to have very advanced blockages and damage to his heart. Very interestingly, I can't take credit for this. That night, a cardiologist walked in and said, you probably need bypass, but we have this advanced clinic at the Cleveland Clinic that's run by Dr. Caldwell Esselstyn. He teaches people nutrition to reverse their heart disease. And he's treated people like you and avoided bypass. And Mr. Chatlin was just ready for that and said, check me out of the hospital. I am going to find out about this. And Dr. Esselstyn called him and said, I'll work with you at a distance from Detroit. And within a very short time, there was a radical change in Paul's diet, weight loss, blood pressure control, cholesterol control, some use of medications, and his symptoms completely went away. His activity levels skyrocketed. He looked great. And a year later, we met because his passion was so high to share with people that he had avoided bypass surgery and he felt great. And he had done it all with a fork and a spoon and easily obtainable, low-cost, plant-based foods. That we set up an organization together called plantbasedsupport.org. It's still many thousands of people learning from experts all over the world, online. It used to be live, but it's mainly online. So he came and started to see me, and I did my deep dive, and he proved to have an incredibly high level of lipoprotein A that nobody had checked. And the only thing that was available then and even now was I did get him into a research study. And he is taking an injection once a month for a medication we hope will reach FDA approval next year, but he's getting it because he's in a research study. And it's a complete transformation. This is a man now 12 years later who's never had that bypass, who is giving back by teaching and teaching and teaching. And it's really remarkable that long-term people, he's not the only one, God knows, that either avoid procedures or after they have a necessary procedure, because not all procedures are inappropriate. They make this transformation: better sleep, better fitness, tremendous transformation in diet, focusing on gratitude and joy and stress reduction, yoga, meditation, breath work. So some supplements if needed. It isn't all about how many pills a day you can swallow down, but sometimes there's a few.
So let's talk about statins for a minute, because I know that statins are a big thing that are prescribed every day by doctors for high cholesterol. Let's talk about your friend. Like, is that something that he was also on a statin in addition to doing all these healthy, healthy eating and all of that, or was he on no medications?
Yeah. Well, it turns out, so I'll give you, 1 minute on statins. I am not an anti-statin physician. However, there are millions of people that at age 45, a woman goes to see the gynecologist or the primary care doc. Mary, your cholesterol is 248. We're going to give you a prescription. We got to get it down. Mary has no problem. She's active. She's leading a good lifestyle. And she has no idea, nor does the doctor have any idea, if she actually has any heart disease or will ever develop heart disease. So the approach that's typical, and it may sometimes benefit people, is here's your statin. Couple problems with that. Number one, if you're taking a statin drug, you should take a vitamin called coenzyme Q10. The biochemistry is clear cut, and most primary care doctors don't recommend that. You just go to a vitamin shop and buy it. Okay. The safest vitamin on the planet. Number two, some of these women are never going to have a heart event, never going to develop heart disease. So 20 years ago, there was a recommendation, very radical, but from some very good academic people, that woman should be tested. Maybe she should get a carotid ultrasound. There's a special kind called a CIMT we do in my clinics, but most people get just a standard one. Maybe she should have this CT scan of the heart called a coronary artery calcium scan, about a $100 test. A cardiologist in Miami at Mount Sinai, Dr. Arthur Agatston, created a software program and something called the calcium score. I just did an interview with him this morning. But in 1990, he created this. And for about $100, that woman or man can go find out. And if they come back clean, free of any heart disease, it was proposed they don't need a prescription drug, just focus on lifestyle and integrative medicine. Maybe a supplement. Maybe they take bergamot or berberine or red yeast rice or niacin, or maybe they just eat a lot of salads. At any rate, that is now the accepted plan, that if you get tested and you have no identifiable, fancy word, atherosclerosis, you don't need a statin. So I enjoy taking many people off of statins, but they have to be tested first. They have no atherosclerosis, and then we're going to retest them again in 4 or 5 years, sort of like a colonoscopy. A good, clean report is great, but you're probably going to go back and get rechecked. So That's one comment on statins. Too many people that don't need them are taking them. The people that need them, the heart attack, the bypass, the stent, the stroke, the person that does have one of these CT scans or carotids or other testing that shows, serious disease. If you combine it with CoQ10 and use it intelligently, they can help those people. They're going to help those people a lot more than the 48-year-old woman who had no disease. You're going to have so many hundreds of women like that to maybe help one, and you're going to harm some of them. It's not worth it. But for the bypass patient, it's worth it. Paul Chatlin that I mentioned, who turned out had this factor in his blood, it turns out statins don't help that. Statins actually make it worse. And Paul developed some intolerance to statins, the typical muscle aching. So he largely is depending on an injectable drug, FDA-approved drug called Repatha, that lowers cholesterol and fortunately lowers this. Plus, he's in the research study on the research drug. So you have to use an intelligent approach overall. But they're not all bad drugs. They're not damaging people's brains. There's a bit of a temporary brain fog, occasional memory loss people get, but stop the drug, it goes away. It's not permanent dementia. Actually, most of the data recently is statins lower the risk for permanent dementia, because when your cholesterol's up, you clog your brain arteries. When you clog your brain arteries, you get poor blood flow to your brain tissue, and that's not a favorable outcome. So does everybody need to be on statins? Should we put it in the water and the white bread? No. And of course, nobody probably should be eating much white bread, but they are part of the approach to a heart patient.
Okay. And then I know you're very much big into diet. Can you tell me what is the recommended diet? Is it, you mentioned you're a vegetarian, but is it keto? Is it paleo? What do you see works best?
Well, in my role as a clinical professor at the largest medical school in America, in the newsletters I write for doctors and social media, which of course you can say what you want on social media, but I take it responsibly, and mainly in my patient care. I read 100 plus new medical articles a week, and I put many of them into newsletters and video letters that are shown all over the place. So I know the literature, and there, if you have heart disease, if you go for one of these CT scans and it's abnormal, or carotid scan, or you've had bypass or heart attacks, there's no doubt there's only one answer. It has to be a largely or completely, let's say 90% to 100%, whole food, plant-based diet. Great example, oatmeal, raisins, walnuts, cinnamon for breakfast may be made with soy milk, a giant salad with chickpeas and beets, and sunflower seeds, maybe with balsamic vinegar and extra virgin olive oil for lunch. And maybe you made a great black bean chili for dinner with sourdough bread and some steamed carrots. Just throwing some examples out. That's what you eat day after day after day after day. If 5% of it, when you go out to a restaurant once a month, you have a piece of salmon, probably not harming the program, although that exact experiment has never been done. For the rest of people that take the time to check their arteries, I mean, there is no data that the ketogenic diet cleans out arteries. In fact, most of the data is the opposite. It will shoot your cholesterol up in about half of the people. I had one this week, a dramatic rise in cholesterol after 6 weeks on a ketogenic diet this woman decided to do. And she was smart enough to get her blood rechecked. And it scared her so much she got the heck off of it real quick. Certainly the carnivore diet. The paleo diet, if people research it, is cleaner than what most Americans eat if you do it right. But if it's very, animal product heavy, which typically the paleo diet is, there is a book out there called The Vegan Paleo Diet, eat like a vegan caveman, not like a meat-based caveman. There is some research that some cavemen and cavewomen ate a very heavy plant-based diet. It may work out okay, but warning, if you're eating a heavy cheese, egg, red meat, processed red meat, turkey, fish, pork, chicken. I mean, my God, people think chicken is a health food. It's not a health food. It's probably healthier than fried bacon, but that's all I can say about chicken. What a horrible industry too, in terms of just destroying, the environment and cruelty to animals, but I won't go too far there.
Yes.
If you're eating that kind of diet, get your blood work done, your blood sugar, your cholesterol panel, your inflammation panel, get it rechecked after you've been on that diet for a while, and make sure you're not walking around with advanced heart disease. It may work out poorly for you. And I mean, that's 99% of the science is consistent with what I just said. Yeah.
Very cool. So let's talk about the business side of it for a minute. Being a very proud integrative cardiologist, what are some of the challenges that you've faced, being an integrative cardiologist?
Yeah, so I'm not mocked by, I practiced in my community long enough, had a reputation that I believe was quite good long enough that when I shifted gears, I got no support from most of my medical peers. They didn't refer me patients. 10 years later, the smart ones will now and then,
Yeah.
Mrs. Smith here, and she really doesn't want stents and bypass. And I don't know what to do with her. You take her. There's a few like that. You're not going to get much support in terms of using alternative approaches. People don't understand. And of course, it's easy to mock if you don't understand. I see many physicians feel threatened when they get a note from me because I do share, my clinic notes with any doctor taking care of a patient that we share. Expensive urine, for all the vitamins, even though there are certainly good science for some vitamins in certain situations, as an example. Oh, how many of my patients have been told by their trainer, their chiropractor, their osteopath, their medical doctor, you have to add lamb back. You have to add red meat back. You're going to turn into a shriveled prune. And, they don't understand and haven't really dived into the literature. So there's all those obstacles. I established a clinic where I don't take health insurance.
Okay.
I did lose about 80% of my patients when I made the transition, even though I cared for many of these people. I understood it. It wasn't an angry moment. I knew it was going to happen. I had prepared by being pretty good at social media and blogging and podcasts and just working, lecture. So there's enough people out there. I also am licensed in about 20 states, which in retrospect they're two smart moves. Getting licensed in other states was a smart move because I don't do it under the radar. I do it legally and officially. I can take care of you in Texas and New York and Florida and Pennsylvania, Ohio. And my God, that's enough in addition to Michigan. But I can take care of you in Arizona. And second was starting up a podcast 9 years ago, a low cost, fairly raw weekly podcast, almost 500 episodes. I've been very, dogged to keep it going, has, gotten a lot of great feedback. But there's challenges, most of us now are employed by hospitals or big medicine. So, signing a lease to buy a printer, signing a lease to have an office space, hiring people and setting their wages and having paychecks or, ADP. Most of us, haven't done that. I hadn't. I had always been in bigger groups where somebody in the back office did that. Now there is no billing office, which is the joy of a cash-based practice. We have an accounts receivable of about 0 right now, which is typically the case. But frankly, because I'm in such a unique space, people are very, very happy to have the counseling that I try and give them, good colleague counseling. And when you talk about your whole life, people are going to spend a lot more on 1 week vacation in Florida than they're ever going to spend working with me.
Right. Yes. And it's their life you're talking about. So, and then what advice would you give to other providers, especially the younger doctors as they're coming in, about, beginning their journey into integrative? What advice would you give them? Why is it important for them to be looking at this type of medicine as well?
One, you got to be authentic. And I'm just pulling these. I did not create
That's
this.
okay. Yeah, I want you to be authentic.
And one, you got to be authentic. You have to lead the life. My patients know my diet, my fitness, my sleep, my vitamin regimen, my testing. I post a lot of this stuff, MRI scans and heart scans, and I volunteer for a lot of stuff. So I can talk to them in the office or put it on social media. 2, you have to be authentic about your skills. So
Okay.
I spent a lot of time getting certified and continue to spend a tremendous amount of self-education time. I mean, I'll buy textbooks for $150. I mean, I wasn't doing that before because I really want to dig deep into brain health, or lately dig deep into kidney health or something like that. So you got to be authentic, and you got to be a student for life. Number 2, I mean, hopefully you can find a mentor. I had a mentor or 2 that I visited out of town to look at their clinic. It was, reasonably helpful in the beginning, but God, when I look back 10 years ago, I like the way I handle my clinic now much more than then. I thought I needed lots of toys and tests, and I bought a lot of equipment then. In retrospect, I didn't really need, and it's been mothballed or sold. You need, here, my competition now is AI, because I got so much up here from reading.
Mm-hmm.
3, I will listen to marketing information. I love listening. If people know a marketer named Gary V, who's one of the best marketers on social media.
Yep.
I'll listen to, 10 medical podcasts a week and 1 or 2 marketing podcasts. I got to keep up to date. I didn't know that YouTube Shorts was such a big deal. So now I make YouTube Shorts. And honestly, I held off getting on TikTok for a long time. I'm in my mid to late 60s. So TikTok wasn't my space, but now I'm on TikTok. And once in a while I hit a viral video. I can't ever explain why I got, 1 million views when I got 6,000 followers. You're all welcome to follow me. Heart Doc VIP is the name of the TikTok, because that's
all right.
That's the name of my podcast, Heart Doc VIP. But I mean, it's fun. And a lot of that comes from, studying. I mean, if I have a great clinic and nobody knows about it, nobody comes, I'm not really helping, and I'm not fulfilling that challenge of trying to prevent 1 million heart attacks. So I got to use strategies. There's a Instagram site called School of Hard Knocks. It's very popular. I think it has 12 million followers, and they're little 2-minute interviews by very successful people. And I just love soaking that stuff up.
So what I hear you saying is, to providers that might be listening, is walk the walk, right? Be authentic, walk the walk, be a perpetual learner, always keep studying, learning more, and be up to date on marketing and what the newest and latest, greatest trends are, so that you can market yourself properly. I love that. As a marketing person, I'm always, telling my docs the same thing. It's very important to, be on the trends, and I'm always trying to stay ahead of the trends. But sometimes I'll have doctors that'll bring something to my attention. Oh, hey, I heard about this. What do you think? And I'll go and research. I'll be like, yeah, that's really on trend right now. So there's so many things. But yeah, just really, you're just.
And I'll just say, do I ever get tired? Does my wife ever say, you're doing another interview? Sure. Or you're creating another, summit online? Sure. I say it, she says it. But the pot of gold at the end of the rainbow is not the money, it's the freedom. Most docs work for big corporations. And when I talk to my peers, they are not happy. Yeah. I am a happy guy. I want to shut my clinic. I want to move my clinic to Florida for 2 months a year, which is what I do. I don't ask anybody but Mrs. Kahn. It's a great thing.
I love that. I love that. Yes, I always tell my docs, because I'm very passionate about organized medicine, that, if I had a one-liner for docs would be, every doctor should give $500 a year to the MedPAC, because the insurance companies are now owning basically, the hospitals, the clinics, the doctors now work for insurance companies. And that's not the way it should be, because that's like having the fox, guard the hen house, right? I mean, these guys don't want to help.
I would have been fired 10 times in the last decade if I worked for a hospital system, because I can be outspoken. I mean,
yes, I could tell that about you.
In the pandemic, I got kicked off of, I am proud, I got kicked off of every social media platform. I got back on some of them. I'm still kicked off some. I'm not on LinkedIn. If you want to know why I'm not on LinkedIn, it's because LinkedIn is an insane, restricted place. I'll get back on, but
yes.
But anyways, you buy your you pay your price. It may not all work out. Do I have a slow day in the clinic? And I go, God, if I were in my old practice, I'd have 50 patients. But that's sort of past tense. I never have a slow day anymore. That's right.
Good for you. If there's one trend that you're most excited about that you've been kind of learning or studying, you mentioned a couple things, you're looking into brain and stuff like that. What are you most excited about that's kind of coming online right now for integrative medicine?
Well, maybe two thoughts. One is kidney health, is brain health, is heart health, is gut health, is thyroid health. The overlap that we teach in functional medicine, that there's a network biology. That's famous words from Dr. Jeff Bland, who's often credited as being the father of functional medicine, that they're certainly interrelated. And although I'm focusing mainly on the heart, man, people are asking me about their brain, their kidneys, and I can answer partly because I study it, partly because most of the approach, if I benefit your heart, I'm going to benefit your brain and your kidneys and your lungs. And that's fun. And we're appreciating that more and more. Probably, as I said, kidneys are getting dragged in. The heart-kidney connection is really the same approach. Number two, it's AI, but particularly right now, it's still in the imaging world. And there's something called a CT angiogram. This is a more advanced heart test, but widely available, where you get images of your heart arteries, takes 2 minutes, non-invasive, but it's all interpreted by artificial intelligence. I've been practicing cardiology over 35 years. I know the history going back, to the very first days when we saw heart arteries. We're in a revolutionary phase where I can tell you with precision, that's the word that was always absent, what's going on inside your heart arteries and what we need to do about it, and then recheck and retest. Is it working, not working? Revolutionary stuff. So to not have any knowledge of your heart health is really dangerous Russian roulette. Don't do it.
And at what age should we start getting that test?
Yeah, I put on Instagram this morning, actually, that at age 20, 25, you should get advanced labs. Okay. And if you have some factors, maybe a carotid ultrasound, because that's a radiation-free ultrasound. But by 35 to 40 would be the accepted age. CT scanning, unfortunately, is necessary. And fortunately, is very low radiation. But there's something called this coronary artery calcium scan. And for $100, you can find out you want to be a 0, and 40 to 45, you should probably have that test. And maybe earlier if you've been a smoker, have some inherited problem. Again, this isn't a plug. I wrote a book with a funny title. I wrote it 10 years ago and I republished it a few years ago. Dead execs don't get bonuses. But it's sort of a game plan, how to get tested, what labs to ask for. Why isn't just a routine annual physical enough? Why isn't a stress test at an annual physical a good choice? And it isn't. It's just to tell you what you need. So there are, sort of programs out there you can read and enact.
Definitely. And thank you for sharing your knowledge and your books. I love that, because, this is what this podcast is for, is to help people learn. If there's one message you want listeners to take away about functional and integrative medicine, what would it be?
Well, given my background, again, unprepared, I would say food is medicine. and pay attention to your grocery list, the quality of the food you're choosing, the nature of the food you're choosing. I like the term plant forward, plant strong, plant predominant. We talk about the perimeter of the grocery store, which is where you're going to find the produce. Hopefully, you don't spend too much time in the meat department. One, it's too expensive. And two, the quality may vary, but spend your income on quality and predominantly colorful, fiber-rich plant foods. I teach people the goal is 30 different plant foods a week. That's a lot. Different beans and peas and lentils and vegetables and fruits and nuts and seeds and spices. Spices count, so you can easily spice up a nice black bean chili and, in one serving have 10 different, plant-based fiber-rich foods. But food is medicine. People's brains are healthier on good quality food. People's hearts are clearly healthier. Kidneys are healthier. It's really dramatic. And if people will take it to the extreme, people with rheumatoid arthritis and lupus and other, serious conditions, some of them are able to get drug-free just through food. And don't discount that. We want to write a prescription so quickly. Dig in deep. Look for people that are counseling people with your condition or just your general health, and find a good path to get yourself healthier with a fork and a spoon.
Fantastic. And then the last question is, and I'd like this for both patients, if somebody's looking for an integrative cardiologist, how do they reach you? And then for your peers, if, one of these physicians listening to the show is like, I'd really love to talk to Dr. Kahn about this, what would be the two ways that people can get in touch with you?
Yeah, I have a central website, drjoelkahn.com, drjoelkahn.com. Well, I guess you have it there on the screen, but
yep,
a lot of people spell my name wrong, even though there's only 4 letters in my last name, drjoelkahn.com, and it links to my clinic and my podcast and blogs and all kinds of fun stuff.
Fantastic.
And for patients, that's an easy place to go. We accept new people. We're pretty backed up, but we'll make room for you. Just had a mom reach out to me by email today. She got it off the website. Her 19-year-old son is just, I think he has a post-COVID vaccine syndrome, and I know how to dabble into some areas like that. So I'm going to get him on the schedule real quick because he's not doing well at college. And for professionals, and please join me in my podcast, Heart Doc VIP, on iTunes, Spotify, nearly 500 episodes, Instagram at Dr. J. Kahn. For professionals, I've had a lot reach out, and I will take the time to call them back and spend 10, 20 minutes, mentoring them. Pretty much what we talked about today. So from now on, I'm just going to send them this interview.
Sounds great.
The thing is, I encourage people to do it. It's a wonderful decision. But, I spent, very honestly, a lot of money on education, a lot of time on education. I continue to spend, my whole life is, I got family, dogs, passions out there, but I spend a lot of time on the art of medicine, the practice of medicine. I take this very seriously. So, you can't just put out your shingle, I'm now an integrative cardiologist, and expect to know what the heck you're doing or really benefit people. Make a plan of attack. My plan of attack took a couple of years at least.
Awesome. Well, thank you very much. This has been an inspirational podcast. I know how busy you are, and I know that, taking the time today to meet with us, I just want you to know it's very appreciated.
Well, you're kind. And since you have a dog and I have 3 and none of them bark during this.
I know.
Say thank you to our furry friends.
All right. Sounds good, Doc. All right. Thank you so much for being on the show, and let you go here.